Do you know about 1.5 billion people worldwide actually suffer from hearing loss? Hello, lend me your ears for just a few seconds of your life. I'd like to talk about your ear and hearing care. So your ear basically has three parts. It has this outside part and a corridor that takes you to what we call the eardrum. This is the one that we usually look at in the clinic. Then we have the middle ear. It also has a corridor that takes you to the back of the nose. So sometimes when you actually sneeze, you can feel air getting inside your ear, and it's through this pipe. And then we have the innermost ear, which is important for balance and for hearing properly. From the balance, or rather the hearing part called the cochlea, there is a nerve that takes these impulses to the brain. If anything happens to this ear, you get what we call hearing loss. Hearing loss doesn't happen just in adulthood. It starts all the way from inception, through birth, childhood, adulthood, even as we age. Anything that affects that can go through infections, trauma, even through leisure activities like noise, or even through simple things that we usually do routinely that we don't really want you to do, like using an earbud. We would like to talk about this in the webinar that is coming up on the 6th of March of this year. We commemorate the World Hearing Day, which is 3rd March of every year. We want you to know about some things that you can do to prevent hearing loss, to prevent ear damage. Things like the 60-60 rule for hearing. If you use a lot of personal listening devices, do you use 60% of your volume, or you put it a notch higher? Do you use 60% of the minutes that you use for hearing to rest up a bit? So these are some of the tips and tricks that we'd like you to know about so that you can prevent ear and hearing damage to your ear. We also would like you to know that if anything happens to your ears, ENTs are here to help, but we don't work as the only health workers. Your pediatrician, your physician, your general practitioner, and even specialized groups like the audiologists and speech and language therapists are here to help if you have problems with hearing, with speaking, with your ear. Thank you.